Hey everybody, this is Dr. Jay Greenstein here, coming to you live from Columbia, Maryland. Today we have a very special guest, Dr. James Whedon. Dr. James, what's happening? I'm going to call you Dr. Jim, if that's okay.
Yeah, that sounds good. That's what everybody calls me around here.
All right.
So, it's very good.
So Dr. Jim, give us a little bit, give a little bit of background of your chiropractic history, and then we're going to talk about the most recent opioid study that you presented at DC 2017. So tell us about yourself.
Yeah, sure. Well, I'm a doctor of chiropractic. I trained at Logan College in St. Louis, and I practiced full-time in Massachusetts for a number of years, then moved to New Hampshire, practiced part-time. So my total time in practice is probably almost 25 years.
Wow.
But in New Hampshire, I also, last few years, I went to work for the trauma program and for the Dartmouth Hitchcock Medical Center, which is the teaching hospital for Dartmouth Medical School. And while there, in my position with trauma, I learned about clinical data management and analysis. And I conducted a few small studies and got some published and kind of caught the research bug and applied for an NIH grant. I was fortunate enough to get funding for that grant for training and conduct of mentored research. And I was mentored by some experts at Dartmouth Medical School in back pain research, and received my MS degree in health services research and conducted studies on the utilization and safety of chiropractic care under the Medicare system. I'm currently Director of Health Services Research at Southern California University of Health Sciences, and engaged in a number of studies of chiropractic and integrative healthcare, and continue to collaborate with Dartmouth.
That's fantastic. Today, the main topic of discussion is research that you again presented at DC 2017, the most recent event where the ACA, the Association of Chiropractic Colleges, the World Federation of Chiropractic got together for one big conference in Washington, DC, my hometown. And just before that conference, in addition to presenting at that conference, just before the conference, you also presented this research at the press briefing put on at the National Press Club by the Foundation for Chiropractic Progress. And so today, I just want you to just tell us about the study, how it came about, why it came about, and then we'll talk about the results.
Yeah. I think we all understand we face an opioid crisis in this country. And I think anecdotally, most chiropractors would say, for people with spinal pain disorders, we offer a viable kind of non-pharmacologic treatment option. And there's strong evidence to support chiropractic care for its safety and effectiveness. In many cases, its cost effectiveness. And patients consistently report high levels of satisfaction with chiropractic care. But if you look at the scientific literature and you're looking for evidence to support chiropractic specifically as a strategy for addressing the opioid epidemic, there really isn't any evidence. So we thought, until now, we thought we would study this and study the association between the use of chiropractic care and the likelihood of using opioid medications. And our approach to this was to study claims data from the state of New Hampshire. The state of New Hampshire aggregates health insurance claims from all the insurers doing business in the state and makes that data available to researchers. So that was our data source for this study.
That's fantastic. And it was over 12,000 subjects. I mean, just a huge sample size, yes?
Yeah, certainly much bigger than most any clinical trial you'll see, although with claims data, you can get very large population sizes. So New Hampshire is a small state. But even so, for a clinical study, that's a pretty respectable number.
So now let's hit the home run. Why don't you tell the audience out there what you found in your study? What were the main results?
Yeah, well, we expected to see kind of an inverse correlation between chiropractic use and opioid use, but what we found was really striking. We didn't really expect to find such strong findings. We found that in the year 2014, recipients of chiropractic services had a 55% lower likelihood of filling an opioid prescription as compared to non-recipients of chiropractic services. And this is in a population of people with low back pain. We also found differences in costs. The cost of average cost per patient for filling opioid prescriptions was 78% lower.
Wow.
As compared to non-recipients, and 74% lower for the charges for clinical services for low back pain. That's all clinical services for low back pain, chiropractic, medical, everything. We also looked at safety. We looked at the likelihood of adverse drug events, not just for opioids, for any adverse drug event occurring in an outpatient setting. So we excluded events that occurred in the hospital. That's kind of a different animal.
Sure.
And there, again, we found very strong differences of 51% lower likelihood of occurrence of an adverse drug event among recipients of chiropractic services. All these findings were statistically significant.
That's amazing, and I guess to a degree not surprising. I think the level of the correlations are so significant. Tell us now what, if a doctor of chiropractic is listening to this right now, what can he do with this? And what can he or she do with this information to help improve population health, grow their practice, what have you? Communicate with other healthcare providers.
Yeah. Well, first, I mean, even before, chiropractors, let's talk about patients. I mean, I think patients, can use this information. Patients, I think, should be able to consider chiropractic as a reasonable alternative to drug therapy for low back pain. Chiropractic is safe and it is effective. And beyond making sense as a non-pharmacological treatment, we now have some evidence to suggest that it's a reasonable alternative to opioids. For doctors, for medical providers, medical providers with patients with low back pain should consider referring patients for chiropractic care. Their treatment they will receive will be concordant with the latest clinical guidelines, which stress non-pharmacological treatment. And chiropractic care as an approach to low back pain may lead to keeping patients off of opioids.
Sure.
Chiropractors can be again confident that their kind of anecdotal experience, their experience in clinical practice, that patients can stay out of opioids, can now feel that some scientific evidence confirms their impression that that's the case. And policymakers can be aware of this emerging evidence and think of consider increased utilization of chiropractic care as possible part of a national strategy for addressing the opioids epidemic.
No question. I agree. It is literally all about the patients. That's why we get up every single day and do our jobs the way that we do them. And I just feel like doctors of chiropractic now need to take this information and they need to utilize it. They need to spread the word. They need because they create more leverage with the dissemination of knowledge. So this knowledge transfer needs to be from doctors of chiropractic to the greater community. And I just feel like there's a great opportunity for doctors of chiropractic to share this information in order for consumers or patients, as you said, to understand really what does the evidence say about how patients can stay off of these drugs and avoid any of these adverse events, and also get great outcomes and have high levels of patient satisfaction. It's interesting, we just had a conference call with the Congress on Chiropractic State Associations today, and I was interviewing Dr. David Elton, who is the Senior Vice President at Optum, and he talked about the fact that, you know, we have a great opportunity as doctors of chiropractic because opioids are prescribed. It's the second, musculoskeletal conditions are the second leading cause of opioid prescriptions. Only cancer comes before that. So you couldn't have had better timing in releasing the results of this study because we do have such an epidemic. The costs are out of control. We know that people are literally dying every single day. Deaths continue to rise due to prescription opioids. And so we have this data now, we have this science now that will allow us to influence the public, influence policymakers to ensure they're making the right healthcare decisions, the patients are, and policymakers, again, are gearing the right solutions towards that national strategy that you discussed. So what's next on the agenda for this study, Dr. Jim?
Well, yeah, I mean, I think chiropractors can be confident in our results. We applied really rigorous methods to these analyses, and we feel confident in our results, and I think the chiropractors can also be confident in them as well, and not hesitate to share these results with their patients and with their colleagues. Still, New Hampshire is a small state, and 12,000 is a respectable number, but what if we were to study multiple contiguous states, and there are a number of states in New England that make these kinds of claims data available to research? We can combine data from Vermont, New Hampshire, Maine, Massachusetts,
wow,
possibly 2 or 3 other contiguous states, and generate an analytic database of millions of patients, and study these associations over several years. And I expect that we would confirm our results, and we'd have something much stronger that I think that, you know, simply could not be ignored.
That's fantastic. So that's super exciting. I'm sorry, I didn't want to interrupt you. What were you going to say?
So that's our plan. We're currently in the process working on data acquisition and getting all the necessary approvals and getting our methods straight for doing this much larger study.
So for these first 2 studies, I know the answer, but I think it would be important for us to recognize the folks who actually helped make it happen through funding. There was a lot of effort that went in from the profession, for the profession, to get this first study completed. We'd like to be able to acknowledge those folks right now.
Yes, absolutely. You know, many thanks are due to the Council on Chiropractic Guidelines and practice parameters, and in particular the Michigan Chiropractic Association. I understand the folks in Michigan contributed kind of more than their share to make this happen. And research isn't cheap. It's you know, research nowadays involves multiple people, investigators and biostatisticians, and the data needs to be acquired and cleaned up and analyzed, and it takes time. So it does cost significant amounts of money. Sometimes this kind of research is much less expensive than a clinical trial, but still, yeah, the funding is important and deeply appreciated.
So yes, the Michigan Chiropractic Foundation made a tremendous grant to help us at the Clinical Compass, the Council on Chiropractic Guidelines and Practice Parameters, help to fund this research. It doesn't happen though without great researchers like yourself. So we want to thank you for just doing a phenomenal job. The results are going to be so impactful for our communities, for our patients, and hopefully for the profession at large as well. So Dr. Jim, any final thoughts before we hang up today?
No, I just, you know, as you say, it's all about the patient. So it's my fondest hope that this will have some positive impact on the care that patients get and on their quality of life.
Amen. You know, I just want to reiterate what you said about the new American College of Physicians guideline that came out. And in fact, not only did they recommend non-pharmacological treatment, but for chronic back pain, they recommended that patients and clinicians should initially select non-pharmacological treatments like spinal manipulation, exercise, the services that doctors of chiropractic provide every single day in their practices for patients. So that was a really important study. Also just came out in February. Actually, it was Valentine's Day when it came out. A new study came out in JAMA today talking about the positive effects of spinal manipulation. So the evidence continues to grow, and patients can feel confident that when they see a doctor of chiropractic, they're seeing an evidence-based provider that's going to help them not only get well, but stay well. So Dr. Jim, thank you very much.
Thank you
to see you.
so much for the opportunity.
We'll see you soon.
Again.
Bye now.
Bye-bye.